Neurological Physiotherapy. Introduction to the module. In this module, the principles of neurological physiotherapy are examined, alongside the diseases and rehabilitation procedures associated with it. Topics to be covered. Introduction to the neuromuscular system. What is neurological physiotherapy? Neurological physiotherapy, rehabilitation. Neurological diseases and impairments. Assessment of neurological patients. Introduction to the neuromuscular system. What is the neuromuscular system? In simple terms, the neuromuscular system is the anatomical connection of all the muscles in the human body and the nerves that carry the impulses. Every time a person moves, it is orchestrated by an interaction between the muscles and brain. This nervous system transmits messages across its network at the speed of thought. The neuromuscular system not only makes complicated movements possible as muscles and nerves work together, but it also allows functional activities such as breathing and heartbeats to occur without conscious effort. How does the neuromuscular system work? All human nerves contain neurons. These are biological cells responsible for sending communicative impulses to the brain, using the spinal cord as a conduit. The neurons that perform this function are more precisely called motor neurons. A motor neuron ending is situated extremely close to muscle fibers. This connection is formally known as the neuromuscular junction. When instructed to do so, motor neurons release natural chemicals that are instantly detected by the neighboring muscle fiber. This makes the fiber contract, and the muscle moves accordingly. What is neurological physiotherapy? The science of neurology is a specialized study of the human body's nervous system. Many known illnesses and disorders can directly affect various systems, including the CNS, central nervous system, featuring the brain and spinal cord; peripheral nervous system; autonomic nervous system. Neurological physiotherapy allows a physiotherapist to perform healing and restorative treatments on disorders caused by neurological conditions. The complexities and challenges that physiotherapists encounter when working in this clinical area can be substantial and can be daunting for some practitioners. Neurological physiotherapy, rehabilitation. The rehabilitation process is designed to allow clients to reclaim their quality of life and provide the best possible results within the physiotherapist's scope. Whilst creating a rehabilitation program, they use all of their evaluation expertise and clinical knowledge, alongside test readings and input from other healthcare professionals. This results in an appropriate recovery plan individualized for the client's best interests. Each rehabilitation schedule works to give the clients access to a better lifestyle. This means that a physiotherapist must establish and understand all facets of the client's conditions and circumstances, making their existence with a neurological impairment be less constrictive and more positive. Rehabilitation, role of the physiotherapists. A physiotherapist who specializes in neurology assists and supports their clients, hopefully leading towards improved mobility, functionality, and reduced discomfort. Most physical therapists focus on the physical activities that a client has difficulties with and how they currently perform them. This leads to re-education in movement processes and the repeated practices of those amended movement methods. These are the two most essential aspects of neurological physiotherapy. However, the physiotherapist also spends significant time with the carers and family members to ascertain the requirements and supports that the client needs. Neurological diseases and impairments. Causes of neurological damage. The majority of naturally occurring neurological conditions come from issues regarding a body's circulatory system, typically manifesting as a stroke or a similar ailment. Neurological damage can also be caused by impact and trauma, as can be seen with head injuries and spinal damage resulting from severe accidents or falls. This type of injury can cause sudden and temporary inflammation and lead to irreparable and permanent damage if the nerve tissue is lost or destroyed. Some diseases directly attack and damage the nervous system, seemingly targeting specific parts. The most well-known examples of these infections are meningitis, syphilis, tuberculosis, poliomyelitis. Some individuals are born with disabilities that have dramatically adverse effects on the nervous system. These include spina bifida, Huntington's chorea, spinocerebellar ataxia, vitamin B deficiency, neoplasms. Unfortunately, others may have been exposed to toxic substances like mercury, lead, or arsenic, which can also affect a nervous system's functions. Neurological movement disorders. A movement disorder can affect an individual if he or she has sensory input diminishment, degraded motor control, or extremely poor muscle tone. This can lead to difficulties in performing simple tasks such as walking or eating, with the person experiencing only partial control of their limbs or displaying involuntary spasms. Examples of these disorders are ataxia, if the cerebellum, sensory, or vestibular systems are damaged due to an injury or an existing condition. This disorder can take hold. Movements can become ungainly and jerky, and functional activities can be significantly affected as the arm generally misses intended targeted objects. Dystonia, previously known as athetosis, if the area of the brain that performs motor functions, basal ganglia, is damaged via inherited conditions or other causes, it is thought to contribute to this condition. Movements can be distorted and appear twisted and strange as muscles involuntarily contract into unnatural shapes. The arms and legs can develop shakes and painful cramps and be seen by others to move strangely. Focal variants of this condition can also affect the eyes, neck or upper limbs with rapid blinking or twitching. The effects may be intermittent or constant. Chorea, similar to dystonia but without twisted and sustained stances, it usually consists of random body twitches. It is generally associated with Huntington's disease. Bulismus, large jerky movements can be seen and are similar to the effects of chorea, but variants can affect just one side of the body, hemibulismus. Tremor, these are well-known disorders that can affect those with degenerative diseases or neurological ones. The limbs and body often vibrate with intense and unwanted movements, making physical tasks sometimes impossible. There are many forms of this, such as an intention tremor caused by cerebellar dysfunction. Bradykinesia, this is characterized as extreme slowness of motion. It is commonly seen as the primary symptom of Parkinson's disease, along with tremors. Impairments. When the CNS is significantly damaged, it commonly results in symptoms known as clinical features or just impairments. Due to its structure, the CNS can be wholly affected if just one part is compromised. This means that a severe injury to a specific area can seriously affect the entire system's functionality, leading to impairments. Impairments are generally defined under the following categories: motor impairments, sensory impairments, visual impairments, cognitive impairments, behavioral changes, perceptual and auditory, communication disturbances, autonomic disturbances, fatigue, bladder or bowel incontinence. Motor impairments. Significant damage to muscles, or the loss of the neural motor pathways or cortex areas, leads to a degradation in muscle controls. This can cause muscle weakness, lack of strength in a singular muscle or a group that work together. Muscle tone, the at-rest state of muscles, which maintains readiness for activity and a comfortable posture. This can be affected by CNS damage and is known as abnormal tone when it is incorrect. Spasticity, a motor disorder that can result in tendon jerks and poor muscle control. Sensory impairments. If any sensory receptors or parts of the brain controlling sensory information are damaged, the following conditions can happen. Altered cutaneous sensation, sensory information from the skin can be abnormally influenced. It may become lessened, anesthesia, completely absent, paresthesia, or overly sensitive, hyperesthesia. This may affect touch and perceptions of pressure or stress. Altered proprioception, the sensory receptors for the muscles are not functioning correctly, and so the position of a joint is unknown to the brain. It can cause balance issues and general unsteadiness at involuntary times. Visual impairments. Significant damage to the optic nerves, visual cortex area, or nerve pathways that control muscle functions can result in these conditions. Hemianopia, a loss of vision in half of the visual field of each eye. Diplopia, images are duplicated, creating confusing double vision. Nystagmus, the eye muscles make fast or slow involuntary movements causing the eyeballs to oscillate or move instead of focusing on an object. Cognitive impairments. Any damage to the brain's parietal lobe causes memory loss and the ability to learn. This leads to issues with a person's attention span, memories, learning ability, emotional stability. Significant damage to the limbic system, behavioral control in the brain, can lead to involuntary depression, euphoria, behavioral changes. If the frontal lobe is exposed to injury, it may cause agitation, disinhibition, reduced motivation. Perceptual disturbances. The act of perception requires a person to interpret and react to received sensory information. If there is damage to the brain in areas that control sensory and motor information, it can lead to problems with figure-ground differentiation, spatial awareness, inattention or neglect, disturbances in constructional abilities. Auditory disturbances. Deafness is not customarily associated with neurological conditions, but it can occur if the body's auditory system is exposed to sudden trauma. Communication disturbances or swallowing. If there is damage in the Broca's area of the brain, where neurons reside for speech function, or associated motor components, it can lead to dysarthria, an inability to pronounce words due to the lack of muscle control and coordination. Speech is often slurred as a result. Dysphagia, if the speech processing part of the brain is damaged, and as a result, a person cannot express or pronounce some words and is unable to understand their meaning. Fatigue. A person feels overwhelmingly tired, even with sufficient sleep and rest and no stressful physical activities. People with multiple sclerosis often show this symptom, and in extreme cases, cannot summon the strength to perform menial or simple tasks. Bladder or bowel incontinence. Damage to the brain's specific control centers can cause a communication breakdown in the digestive system and bodily functions. Loss of this can also affect the muscle control associated with them. Autonomic disturbances. These can result from nerve or spinal damage and manifest into autonomic dysfunctions. This is an overreaction by some bodily functions to external stimuli. A person sweats profusely, displays hypertension and elevated heart rates, and experiences diarrhea or incontinence at inappropriate times. Assessment of neurological patients. For a physiotherapist to provide an accurate diagnosis when working in neurological physiotherapy, sufficient data needs to be obtained from the client regarding abnormal movement patterns, movement or sensory impairments, restricted activities, social interactions. The wide range of symptoms that clients can display demand challenging assessments and need thorough investigations. It may also necessitate input from several different teams and healthcare professionals. Joint assessments may be appropriate and often need to take place over an extended period to not tire or apply stress to the client. A more extended period also provides an opportunity for more accurate data gathering. An accurate assessment needs both subjective information, medical records, interviews, etc., and objective information, physical examination, observations, etc. Subjective assessment. Gaining accurate data and information about the medical background of a client is essential to any assessment. It can be found from official medical records, doctor's notes, and interviews with the carers, relatives, and clients themselves. As well as gathering data, this also helps to establish a proper social connection and rapport. Good communication is a vital part of this process and is instrumental in the effective treatment of the client by the physiotherapist. Ideally, these interactions can be scheduled at the client's home for reassurance purposes. Objective assessment. An objective assessment relies on keen observation and thorough examination, which initially consist of merely watching the client's movements and activities. This allows a physiotherapist the chance to assess natural movements and any apparent degradation of mental, cognitive, speech, and behavioral abilities during simple tasks or everyday routines. At this time, a physiotherapist must avoid giving an indication to the client of their current condition and symptoms. Appropriate verbal instructions, requests, and questions may be made, however. The critical questions that physiotherapists should ask themselves during an assessment are: how does the client's body position itself at rest? Is there a natural alignment, or does noticeable asymmetry exist? Can the client perform specific movements or tasks with ease or apparent difficulty? How does the body move in coordination? Does the client show signs of balance problems or adopt an unnatural posture? Does the client show a good range of movements, or are there apparent restrictions? Are the movements of the client relatively smooth or jerky, quick or slow? Are they strained or effortless? Summary. This module has covered the following points. The neuromuscular system is the network of nerves and muscles in the body that enables movement. Neurological physiotherapy is considered a specialization of rehabilitation methods that treat a neurological condition. The main objective of rehabilitation is to restore a good quality of life to a client and enable the best functionality. Most neurological conditions originate from problems or injuries that affect the body's circulatory system. In order to diagnose conditions in neurological physiotherapy, medical and observational data must be combined.